Hi, I'm Allie Cook of Dentistry Today, coming to you from the Chicago Midwinter Meeting. I'm here at the Kuraray America booth with Dr. Kurtzman, who is a Dentistry Today author and leader in continuing education, and also an expert for Kuraray America. Dr. Kurtzman, it's nice to be here with you today.
Thank you, Allie.
What product are you showcasing?
We're going to be talking about two different products, a new adhesive, S3 Bond Plus, which is a reformulation of their popular S3 Bond, which was introduced in 2005 and is basically a single bottle 7th generation self-etch adhesive, and also their reformulated DC Core Plus, which is a dual cure core material. The benefit of these two materials are that they've been matched together accelerator-wise, so when used together, we can basically get the adhesive to be set by the DC core without any light, which is advantageous when doing post and cores. The benefit of the S3 Bond Plus is it comes in a multi-use bottle or in single-use compules. The DC Core Plus comes in two different shades, as we can see here, either an opacious white or A2, and it's been reformulated so it does have a lot of flow, but also is non-slumping, as we can see here. We can build up a body with this and we don't have to worry about it slumping and running, and then we can either let it self-cure or we can light cure it. And we're going to talk about a couple of cases here to illustrate how this can be used. The first case basically talks about a core buildup, not using any posts, in a tooth in this case where it has a defective amalgam that is going to get a crown. We want to remove the old restoration, remove the decay, do a core buildup prior to doing the crown preparation. And as we can see here, we've removed that old amalgam and the decay, and this is what remains of the tooth. And as we can see, there's not a lot of tooth structure there, so we will need a core buildup. So we basically put a matrix around there to contain the material. We're going to basically dispense our S3 Bond Plus into a dapping dish and use a micro brush, and we're going to scrub that into the dentin on that. It's a self-etch material, so we want to avoid using a phosphoric acid because that will actually weaken the bond in self-etch materials. So we're going to scrub that in, and also the benefit of this material is they've shortened through improved chemistry how long you have to light cure this. They've gone from 20 seconds down to 10 seconds. And in this rush world where we want to do things faster, this really fits into our clinical models. We light cure that for 10 seconds. We then basically go to our DC core material and we want to put a very thin layer just covering the dentin. They've basically been able to show through studies that if we put a very thin initial coat down, we're going to get a higher bond strength than if we bulk fill the entire material. So we're going to basically put a thin layer down, just covering the dentin. We're going to then light cure that. Then we're going to basically bulk fill with the remaining material all the way up to the top, light cure that, and I personally like to wait another 3 minutes to make sure it's gone through self-cure mode so that I know everything is cured all the way down to the tooth structure itself. We then can remove the matrix band, create some anatomy in this, send the patient home, return for the crown prep, or we could do our crown prep at the same time. We can also use this for post-cementation and core buildups together. In this case, basically, a patient presented with an old crown on a root canal tooth. The crown came out and could not be placed back in there. And as we can see, there is gutta percha exposed on one of those. There's some stained core material because no posts were used in this, but there's sufficient tooth structure there for ferrule. We remove the old composite, remove the stain. We do some post preparations in those 3 canals. And if we remember, posts are there to retain the core. So in my opinion, I like to put a post into every canal just to lock in that core so we don't have to worry. We're going to basically take our S3 Bond Plus, as we did before, on a micro brush. We're going to scrub that into the canals. We're going to scrub it into the core preparation. We're not going to light cure this, but we're going to go to our post and coat it with ceramic primer from Kuraray, which is going to improve our bond to that fiber post. We're going to let that sit for 30 seconds and air dry that. We're going to then paint our S3 Bond Plus on the post to make sure that we have a good bondable surface and light cure that. We're going to then basically squirt just enough material of the DC Core Plus into the post preparations to just fill it up to the orifice and passively slide our posts in, and then we're going to light cure this. This ensures that everything that's in there, the DC Core Plus is going to set our S3 Bond Plus that has already been applied in there and is not going to interfere with us placing our posts. We can then basically build it up with additional material, light cure that again, wait 3 minutes for it to go through the self-cure mode so we know everything's cured. And we can do our crown prep, and as we can see here, we have sufficient ferrule around that tooth in order to basically be able to restore that with a crown. Patient returns 2 weeks later, the crown is placed, and the patient is happy, and we can move on from there.
What are some of the things about the Clearfil line that set it apart from its competitors?
Well, one thing you have to remember is that the first adhesives that were introduced into dentistry were introduced by Kuraray in 1979. So they've been pioneers and leaders in adhesive dentistry. And the Clearfil SE Bond is really the gold standard that other adhesives are compared to.
And for those people watching this at home who might not be able to come to the meeting, how would you recommend getting more information?
They can go to their website at www.kuraraydental.com.
All right, thank you so much, Dr. Kurtzman. Very great information here. And always, for more information, you can visit our website at dentistrytoday.com.